program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
When the pandemic started last year, most people thought that this would be a very short stint, a flu outbreak that would last a couple of months, 3 months at the most. Well, that could have not been any further from the truth, because 18 months later, we're still living with the coronavirus. In fact, we're on the third wave with newer, deadlier strains of the virus. Much of life is the complete opposite of what it used to be. We now work from home. We've been introduced to movement permits. Delivery services are now popular in the country as more and more service providers are becoming more creative in the way they do business. Unfortunately, there have been some not so good things that have happened since the pandemic outbreak globally. The world economy continues to be in shambles as millions continue to lose jobs. Organizations and corporates are collapsing as they fail to keep up with the pressures of the pandemic. With all that, however, came the vaccines, which have brought a semblance of familiarity, especially in countries where a substantive amount of people have been vaccinated, especially the elderly. Well, the hope is that we will reach that level here in Botswana as vaccinations continue to be administered, where at the time of recording this segment, more than 105,000 people had been fully vaccinated. Be that as it may, will life ever get back to normal? Are our lives ever going to go back to how they were pre-COVID? Dr. Kiran Bhagat talks to First Issues.
I think it's a question that's on everybody's minds. Often the question is, will life get back to normal again? Will we have our lives back again? And what is it to be expected with the rollout of the vaccine? With many people now having had COVID and recovered, fortunately the majority of them, they're asking what now, next? And I call it the new normal. It is unfortunately a situation where the public needs to understand that the pandemic is not over. There are still many things to come and many issues that we need to contend with following vaccination and following recovery from COVID. We need to take examples of what's happening, for example, in the United Kingdom, where certainly, in my opinion, the opening up of the economy entirely may be flawed in that the rise of variants or covariants, particularly the new one called the Delta and the very, very new one called the Lambda, will continue to plague us in terms of viral mutants, which are part and parcel of the vaccine now being able to demonstrate effectiveness against these new variants. And as a result, people need to be aware that the most important thing about the new normal is that we all need to be vaccinated. If we are vaccinated, and we estimate, or epidemiologists estimate, that if more than 70% of the population is vaccinated, the chance for these mutations to arise is less. The fewer people that are vaccinated, the more likely it is that people will transmit the virus, and that virus will replicate to try and find ways to remain in the system. So the new norm amounts to a lot of things, Ponatsego, in terms of the public getting used to the way we behave, the way life goes on at the workplace, what happens at home if you have a partner that's infected, etc.
So, Doctor, what are the susceptibility issues? Who's still at risk even after getting vaccinated?
I think that's a really important question. Those that are at risk even after the vaccination are those that are still susceptible. One must remember that no vaccine is 100% protective. Even in the polio, measles, mumps, and the old vaccines which we give to children during the immunization schedule, no vaccine provides 100% cover. These new vaccines provide a remarkable amount of cover, different vaccines providing different cover. But it's important to remember that if it, for example, gives you a 75 or 80% cover, there is still a remaining chance that you may get infected, albeit less so with the COVID vaccine. So it's important to remember that one is still at risk, irrespective of one's background pre-existing risk factors. And the ones that we find that in spite of the vaccine are coming back with another dose of the COVID virus are those that have pre-existing illnesses, particularly diabetics, people who have pre-existing lung disease such as asthma or what we call chronic obstructive airways disease, those that have worked in the mines or have had lung damage as a result of tuberculosis. those that have blood pressure, those particularly, in fact, top of the list are those that are overweight or obese. We know that people who are significantly overweight, for reasons that will come clear in a minute, pose a much greater risk for reinfection. So those that have pre-existing illnesses, in spite of the vaccine, still need to be cautious. And as we've always said on our other programs, it is the time now, in the new normal, for those with pre-existing conditions to actually tackle those pre-existing conditions with much more concentration and vigor, much more resilience and much more aggression. Control the blood pressure, control the weight, make sure you exercise, make sure you build your immune system so that if you do get exposed to COVID, you have a stronger immune system. Those that are diabetic, those that have blood pressure, certainly with obesity, what happens is the obese individual is highly inflamed. The fat in the system makes the body inflamed, and the inflammation predisposes towards the virus. So this is important in terms of those that remain at risk and will remain at risk in the future, in spite of the idea currently being mooted about booster vaccines after you've had your initial single dose with Johnson & Johnson or double dose with AstraZeneca. Should we need a booster dose? And this is something that's currently being played out in countries such as North America and in Europe and in the UK, where many people have had their double dose of vaccine.
There's just so much going on, and there's a lot of fear, and emotions have been heightened. So how do we separate the facts from the fears that we're feeling, and the emotions from the evidence that is there?
That's a really good point, Ponansego, and I think that it's a point that is driven home largely because we are now all on our social media. With the lockdown happening, people had to resort to other forms of information, whether it's Facebook or WhatsApp or email or YouTube, and people have been accessing sites, unfortunately sites that are created by huge lobbies with lots of funding to create various anti-vaccine movements, anti-COVID movements. Some actually claim there's no such thing as COVID. Others claim that COVID doesn't cause the high mortality and morbidity, in other words, infections in the hospital. So a lot of this has actually scared the public. One must remember, Ponansego, that the majority of the public listening to YouTube or reading these WhatsApps have no basis in science. Many of them are housewives or young adults who've not had a scientific grounding, who have no basis or understanding of statistics or epidemiology. When we go to medicine as doctors, we learn a whole set of skills in terms of how to manage, how to address risk, how to read a scientific paper. And so what has happened is much of the public who are ignorant or illiterate in terms of the scientific basis of medicine and science are now having to learn a new lexicon, a new dictionary, comorbidities, coexisting infections, statistical values. And these things often mean nothing to much of the public, but then they are misused and abused by vaccine anti-vaxxers and anti-COVID proponents out there that try to convince the public about the harms of vaccination, about the use of antibiotics, or the fact that COVID is actually a mild illness that will not kill people. So it's very important to separate evidence from emotion and fact from fear. And in this respect, I often ask the public to think like a doctor. Think the way we think in terms of how we manage our risk, how we assess an individual's risk stratification for succumbing to COVID or dying from COVID. How will you analyze a statement being made by somebody that this vaccine is not working, or this vaccine is going to be tagged by some metallic element which will track you? I mean, there's lots of absolute nonsense that's gone on. And one has to always remember that the entire scientific community cannot be wrong. When somebody says something on a WhatsApp or a YouTube, look at the credentials, look what authority they have, go and look at the entire paper. Just like the tabloid media, the public are attracted by headlines. Look behind the headlines and look at the evidence that currently exists for the use of, for example, supplements, or a current controversial subject is ivermectin. And look at the evidence. Look what the World Health Organization, international bodies, international journals are saying about this, because these are lobbies that have got scientists and statisticians and epidemiologists and physicians and clinicians that are steeped in the practice and the basis and research of medicine. So this is what I'm asking the public public to do. Think like a doctor, not like the public, when you're trying to assess and analyze and evaluate the statement that's being presented to you, whether it's on YouTube or WhatsApp.
In Africa, help is what we do. That is why we at FNB are relentlessly driven to provide real help to you, the passionate and courageous, the creators and the optimists. These are the entrepreneurs we support, the communities we uplift. It is because of you that real help is what we do. FNB, how can we help you?
Maybe this question is similar to the one I just asked, but how does one, remove the paranoia of a simple cough, not being COVID, but a simple flu?
That's a really good question, Ponaseko, and I think, it's been a chilly winter and there are lots of, suppressed coughs that are going on. The public are absolutely paranoid and have mental anguish and anxiety when they cough for fear that their colleagues will think that they're spreading the COVID virus. It's important to remember that the advice we gave with regards to flu and influenza before COVID apply now. When somebody has flu, stay at home. If you're somebody that goes to work, be sensible and think of your colleagues, because your colleagues don't want to get flu as well. We now know from countries that are now in summer that have had their winter that the incidence and prevalence of flu during their winter was less because people were social distancing, they were masking, they were staying at home when they had flu-like symptoms, they washed their hands frequently. So these are the same principles, whether you think you have COVID or not. If you have a cough, be careful about the people around you, even in the family. Try and make sure that you cough into your arm. Make sure you wash your hands. Wear a mask where possible, because these things can protect you. A mask can reduce the transmission of influenza and COVID by between 60 and 70%. If you have a proper mask that's well fitted, remember that COVID, just like influenza, is an airborne transmission. So it's really important to make sure that you take the same precautions. So if you have flu, and generally flu, everybody knows what flu is. Congestion in the head, it's a runny nose, it's a slight cough, it's a fever. Take a little bit of paracetamol, take lots of warm fluids and stay at home. And if you recover, then Bob's your uncle, it's probably just a transient flu. If you're not sure, stay at home. And if you're really unwell, go and ask your clinic or your doctor to undergo a COVID test, because these are important things. So during the winter, it's time to be more cautious. It's time to wash your hands more frequently. It's time to socially distance. It's time also to make sure that there is ventilation wherever you are. We know the one thing that's really important about COVID and influenza is that if you have good ventilation, it washes out the air that's in the system, particularly if you're in an office with lots of people. Ventilation is important.
First aid kits are always a good thing to have in your home, for other conditions as well. But right now, what is the most important first aid kit tool that we must have in our kits?
That's a good question. I think when with previous lockdowns, the public was caught unawares and went shopping for all sorts of things that probably weren't relevant. Hoarding toilet rolls and bags of Millimil and what have you, instead of thinking, what do I do if there's a crisis, a medical crisis at home? Because people didn't want to go to the hospital, they didn't want to go to the clinic, they weren't allowed to travel out. So this has come about, and our understanding about what a first aid kit should be in terms of simple things and remedies that you can keep up at home are common sense, but sometimes what is common sense is not common practice. Something like paracetamol to keep your temperature down. Lots and lots of water. If you drink tap water, that's fine. If not, lots of bottled water. Make sure you have Disprin or aspirin if you want to gargle to make sure your throat is feeling better. Take some supplements that are kept at home, such as vitamin C, zinc, vitamin D. These things are important in terms of prevention of COVID. Make sure also that you have something that you can inhale to keep your chest clean, whether it's Vicks or camphor or eucalyptus. Inhaling some of that will actually relieve some of the congestion at home. Then, of course, if you have the normal things, your cuts and bruises, keep some bandages at home, keep a little bit of iodine or betadine at home for cuts and bruises, and make sure that your kit is kept in a safe place that nobody has access to. The same with food. Touch wood, we're not going to go down into a future lockdown, but keeping a sensible pantry where you have an emergency supply of tin food, dry goods, etc., for a future lockdown is also important. These are the things that we've learnt in terms of managing both first aid kits as well as some emergency food at home.